Welcome, everyone. Thank you for joining us for today's webinar. My name is Chris O'Grady, and I'm the Childcare Development Fund Administrator at the Early Learning Division. The mission of the Early Learning Division is to support all of Oregon's young children and families to learn and thrive. We work as an integrated team focused on childcare, early learning programs, and cross-systems integration, policy and research, and equity. Today's webinar is on the Childcare Costs of Quality Study and impacts of HB 3073. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the question and answer box in your Zoom webinar control panel. Because of the limited time available for the webinar today, we have disabled the chat function, but we will try to answer the questions as they come up during the presentation. And if we're not able to do that, we will type up the responses and send them out via email as well as during the presentation. And we may read some of the questions aloud to our presenters at the end of the presentation. Closed captioning is available if you click on the option at the bottom of your Zoom platform screen. Today's webinar will be recorded and available at a later date on the Early Learning Division's website. To begin, I'll turn the time over to David Mandel to introduce himself and have him ground us in the important passage of HB 3073 and what it means for the early learning system in Oregon.
Thank you very much, Chris, for that introduction. As Chris said, I'm David Mandel. I'm the Chief of Policy and Research at the Early Learning Division. So we just wanted to provide a little bit of overall policy context for today's conversation and some of the opportunities moving forward that we will be talking about today. So I think a lot of this should be familiar to a lot of you on the call, but I think it's just important, in terms of where we are in this conversation. HB 3073 was passed by the legislature in June of 2021. And the bill does a number of really important things for the early learning system. So one of the first things it does is it creates a new agency, Department of Early Learning and Care, as a sort of standalone agency to oversee really the work of early care and education, including school age care. So that new agency will build upon the Early Learning Division that's currently within the Department of Education, include the licensing and regulatory responsibilities, as well as the work for supporting the professional learning system and administering programs like Preschool Promise, Relief Nurseries, Oregon Pre-Kindergarten. The bill also brings employment-related daycare, which is currently within the Oregon Department of Human Services, into the Department of Early Learning and Care, with that transfer date happening in July 1st of 2023. So it's just a new opportunity to really have a more integrated approach around childcare, supply building, childcare assistance under the new agency. And the bill also makes some really important changes to employment-related daycare, including additional eligibility and flexibility for that really crucial childcare assistance program for working families. That includes a sort of a stronger definition of 12-month eligibility for families, eligibility for students who aren't involved in work, as well as some other eligibility changes. It also directs, and I think this is important context for today's meeting, it directs the Early Learning Division to work towards cost of quality as for reimbursement, which is now allowed under the Federal Child Care Development Fund regulations, which really are the source of most of the dollars for child care assistance and provide really the regulatory structure, and asks the Early Learning Division to submit a report to in December of this year to the legislature on steps towards moving to an alternative rate methodology based on cost equality. And we're going to have a chance to hear some pre-work today that will really, I think, set up that conversation. And I think with that, I will hand it back to you, Chris.
Next slide. So the goal here in moving to the alternative rate methodology is to move to an alternative rate setting structure that's determined by operating cost rather than market price, and develop subsidy rates such that employment-related daycare families can theoretically access at least 75% of childcare providers in the state of Oregon. Some of the factors that we will be looking at to include an alternative rate methodology include looking at different scenarios incurred by childcare providers, including participating in quality improvement structures, providing culturally or linguistically specific or appropriate care, providing evening, overnight, or weekend care, providing care to children with a diagnosed disability, providing infant or toddler care, providing care to a population that has been identified as historically having an inadequate child care supply, or providing any other specialized care that justifies a higher rate of reimbursement. So while we're putting this alternative rate methodology, there are some key dates that we'll have in mind as we're doing this work. Next slide. As an overview of what these tentative key dates are, is the first step in this is to create our alternative rate methodology work group or advisory committee. And we will be looking for different community partners in our CCR&Rs, our childcare providers, and our unions to be members of this advisory committee. And our application is actually now live up on the Early Learning Division website. Our goal is to have our first meeting of this advisory committee in February of 2022. This work group and advisory committee will then be working on the report to the legislature of what will be included in the alternative rate methodology, and it will be due to the legislature on December 31st of 2022. After we submit this report, we'll also be working to submit the report and the outline for alternative rate methodology for Federal Office of Child Care approval for the Child Care and Development Fund. And we'll be looking for this approval and the feedback from the Federal Office of Child Care between December 31st of 2022 to March 1st of 2023. Then we'll be working with our childcare provider unions, AFSCME and SEIU, and working through what the alternative rate methodology means and rates during our bargaining process in March of 2023. We'll then be ongoing in our rulemaking process as our new agency for July 1st of 2023. And then the new rates that are informed by the alternative rate methodology will be implemented on January 1st of 2024. Next slide. So how the alternative rate methodology and the cost of quality study really come together is that we worked with the Center for American Progress and a team of researchers that are on the call today, Simon Workman and Gina Caputo, on the cost of quality study to really inform how we move forward for the alternative rate methodology and different variables that are considered in the cost scenarios. And this work began in 2020 with a technical working group with many different community partners and childcare providers providing their input on what the different cost scenarios are for childcare providers in Oregon. We then worked really closely with all types of childcare providers on our data collection, and this data collection occurred between November of 2020 to December of 2020. This study collected data from the pre-coronavirus period in order to establish a baseline, and this data will be used as a baseline as we move forward in the considerations for alternative rate methodology framework. And without further ado, I'm going to turn it over to the researchers and the results of our cost of quality study to go over the framework and the model that was developed. So Simon and Gina, I'll now turn it over to you.
Thanks, Chris, and good afternoon, everybody. My name is Simon Workman with Prenatal to 5 Fiscal Strategies, which is an initiative that I co-lead with Gina Capito, who's on the call as well today. And P5 Fiscal Strategies is an initiative that's really focused on helping states and communities really address a lot of the fiscal issues and conducting fiscal analysis related to the prenatal to 5 system. And that's everything from, prenatal services, home visiting, childcare, pre-K, the full P5 system, and anything that touches on finance, which of course everything touches on finance. So very much focused on the systems level work. We most recently worked in New Mexico, which some of you may have heard of. Just recently, last year, moved to setting rates in this alternative rate methodology. While states have been able to do alternative methodology for a number of years, very few have done it. To date, only the District of Columbia and then New Mexico have done it. So, it's great that Oregon is moving in this direction, and certainly you are at kind of the leading edge of where states are moving from there. And, we're able to bring our expertise in working. Gina worked closely with DC on theirs, and we both worked with New Mexico most recently. As Chris mentioned, the study we're going to talk about today, we completed in the sort of 2020-2021 timeframe, under contract with the Center for American Progress, where I was previously the Director of Early Childhood Policy. So, we'll refer to this often as the Center for American Progress model, or that was who it was done through. But it's still us, just in different roles now, just so we're clear on that. So before we get started, I did want to just kind of, moving on to the next slide, think about what we are doing, and sort of go through the sort of study background and the study process a little bit more. First, we'll give you some background on what we did. Then Gina's going to talk through a little bit the actual cost drivers and what was in the model and what we found from all the data collection that informed the cost model that we developed. Then we're going to just show you briefly the model so you understand kind of conceptually what we're talking about in terms of when we keep saying cost model. And then share some initial results, just so you can kind of see the sort of outputs you can get from the model. But first, I want to clarify what we're talking about when we talk about a cost of care study. So, back in 2020, when we began this process, really the question that at the heart of this was, that simple question of what does it actually cost to provide high quality childcare, right? A question that sort of seems simple, but is not necessarily simple to answer. And the reason for this is really comes down to the fact that the childcare market is broken. I think probably everybody on the call today understands this, but just to kind of reiterate where our starting point was that, the tuition rate that a childcare provider sets is often just set based on what the market can bear. So you have to set your rates based on what families can afford to pay rather than what it actually costs to deliver those services. And so what that means is that providers have to build a budget. They have to, build their program operations based on the revenue that they can generate. So, you have to look and say, what revenue can I generate? And then what type of program can I run based on that revenue I can generate? And what does that mean? Well, first and foremost, it has led to the poverty level wages that we've seen for childcare staff, in Oregon and across the country, honestly, for many, many years, which is obviously bad on its own, but also leads to high turnover, which is, bad for kids and bad for child development at this sort of really key period in child development, where, trusted relationships are so important. Having high turnover, having staff who are, dealing with their own toxic stress, their own stress about where they're, taking care of their own family, it is a real problem. So, that sort of scarcity mindset have come from so far, where, the model you are delivering, the program you are delivering is based just on what families can afford to pay, leads to those low wages, leads to understaffing, leads to under-resourcing, and programs not being able to run their programs the way they know they want to, based on, the development science and everything they want to do for kids. So the idea is to do a cost study. The cost study is intended to say, okay, what should it really cost? And what does it cost at different levels of quality, right? You can have a cost for meeting, licensing standards, but then you can also have a cost for meeting higher standards, whether that's a quality rating improvement system, something like Spark, whether that's meeting some sort of national accreditation like NAAYC or NAFCC, right? There are different sort of answers to that question of, what does it cost? It's, depends on the what, and what level we're talking about. So the idea behind doing this study was to be able to sort of understand all those nuances of understanding cost and build a cost estimation model, which then allows you to see the different fiscal impacts of all the different program characteristics, things like, how does it differ by the size of a program? How does the cost differ by the ages of children served, right? It's a big one there, that if you take all the 3- and 4-year-olds or the preschoolers out of a program, what does that do to the cost of infant and toddler childcare, right? Spoiler alert, it makes it really high. You can use the model to kind of put the data behind the information of all those different variations on the cost. What we also do with the models is put the revenue side in there as well. So you can then start to say, okay, if the cost is this, what is the revenue that is available? What is the gap between, the costs and the revenue? Even if you've got multiple revenue sources, right? Even if you're able to access multiple revenue sources, you can still demonstrate if there is a gap, which can be particularly helpful when you're trying to talk to policymakers and other kind of key stakeholders to really show, yes, maybe the rate has increased, or maybe we have this ARPA funding now, but there is still a gap. There is still this difference between what it actually costs to provide quality childcare and the revenues that are available. And so you're really taking all the things that we all know by working in this field and putting real data behind them, so that we've got real data to inform the decision making. So that was kind of where we started back in 2020. And then so we went through a cost of care study process. So on the next slide, this kind of shows you the key sort of 6 steps through this process. And what you see here is that the study and the model rely really heavily on stakeholder engagement and good data. Good data in, good data out is kind of our mantra through this. And so a key part of this is both convening stakeholders, and that's, we convened a work group back in 2020 of people to sort of inform this process. So it wasn't just Gina and I kind of sitting doing this ourselves, but actually we had key Oregon stakeholders involved in there, including providers and from across the state. And the point of that group is to help determine those key cost drivers. So what is it that programs are being asked to do that specifically have a cost related to them? And then we went out and collected data from providers. And that's always a key part of this work, is going out and asking providers to share their current data on their current finances, as well as talking about what would it cost to operate if you weren't operating in a scarcity mindset, right? What would it actually, if you wanted to pay teachers that weren't going to turn over every 3 months, what's the amount you need to pay? If you wanted to stack your program at the level to meet all of the things you want to do in your program, what would that be? So we use all of that data and use that to inform this model. And the model that Gina is going to show you in a little moment here, you'll see, is a dynamic model. It's not just a one single answer to that question. We are using all of this data, and you'll see in a minute, we've got a lot of great data from the state, from providers across the state. It's using all of this data to then say, okay, now we're going to run lots of different scenarios. We're going to look at different sort of variables, and then be able to say, this is how all these different variables impact the cost. And so specifically in Oregon, just on the next slide here, we developed these cost models in 2020, 2021, building on, we'd actually done some earlier work with the Center for American Progress, and a lot of this has also been supported by the National Collaborative for Infants and Toddlers, which helps support some of this work. We formed that technical work group, and as you see here, representatives of centers and family childcare homes, as well as licensed exempt providers, Head Start providers, ELD staff, and also the researchers from the University of Oregon who do the market price survey, right? Who have a lot of knowledge about the sort of current market prices in the state. So bringing that in as well. And that technical work group, we met over the period of about 6 to 7 months, really to guide this work, to guide our outreach to providers. And that outreach to providers took place in that kind of fall, winter 2020, 2021, as Chris said. Obviously we were navigating COVID through this. We were generally asking people to share their pre-pandemic data so that we kind of had a full sort of baseline of the pre-pandemic. I think at that period, we were hoping we'd be out of the pandemic by now. Obviously, we're not. That's one of the things about having a dynamic model is you can sort of change things on it as you need to. In order to be, as inclusive as possible, we made the online survey available in English, Spanish, Russian, Vietnamese, and simple Chinese. And we did interviews in English and Spanish as well. And so, really we're trying to make sure we were getting to all parts of the state with that data collection. And, on the next slide, we're just showing you briefly of the survey responses. We got over 1,000 responses to the online survey, which was a really great number. Thinking about some other states we've worked in, we were very happy to see that response rate, because we are asking for, financial data, and sometimes providers don't have that as readily available, or don't necessarily want to share that with people they don't know. But we got over 1,000 responses, which was great. A lot of family childcare homes represented here. You can see in this pie chart. We got data from 33 counties, and I think the only counties we didn't get representation from were very small counties with very, very few, just a handful of licensed childcare providers. And remember, this was also during COVID, where a number of programs were closed down. So all this to say, we did this survey, we supplemented the survey with some targeted interviews, and we feel like we got a good response from providers and a good lot of data, which is informing the model. So I'm going to now turn it over to Gina to talk more about the actual model and the cost drivers that are driving the model.
Thanks, Simon. All right, so let's dig in a little bit on your cost drivers. So what we start with is sort of the overarching what drives cost. This isn't unique to Oregon by any means, and you can see that it's fairly comprehensive when we think about the idea of cost. As we talk about this, and Simon already alluded to some of this in the earlier slides, is that there's clearly certain things that are a bigger impact on cost than others, and that's sort of where it becomes even more important to understand those differences within a state. And when we're building a model, build in those differences so that when you run scenarios in the model, you see the impact of things like higher salaries, lower ratios, group size. But overall, the big cost drivers that apply across all childcare settings fall into these categories of ratio and group size, obviously the staffing and compensation, as well as the staffing patterns. So what kind of coverage you have for staff plays into staffing patterns, how many staff are in a room, obviously plays into ratio as well. We do look at non-personnel cost drivers. In a second, we're going to take a look at sort of the impact of staff salary and benefits, but we do acknowledge that there are instances where particularly occupancy can be a significant cost driver for a program, depending on the scenario of the setting that the program is delivering the services in. But we also try to acknowledge and avoid belaboring points like how much crayons cost and how much construction paper costs and things like that, because at the end of the day, those are not what usually makes up a majority of the cost of childcare, whether at any level of quality, that it's really about the staff that are working with children. And then we build in things that may relate to your individual state system and approach around things like child assessment, whether or not family engagement is required, and whether the activities may include things like parent education nights where food is offered for the parents, or childcare is offered so parents can participate in parent groups and their children are cared for at the same time, right? Family engagement can be on quite a continuum of not having really any additional cost to having much more robust costs, and even thinking about like Head Start or early Head Start model where there's family support specialist staff on the team as well. And so we acknowledge the possibility of those types of cost drivers, and then go with working with the state or community in building the model that's specific to that. So you'll see also kind of how that plays out in your model in particular. And then, as Simon mentioned, we also factor in revenue and those things that link to the revenue drivers. So then we end up with more of not just understanding the cost, but the gap between what the cost is of care and then the available revenues to cover a given child or family and pay a program for the service, and whether or not those available revenues meet what the cost of the service is. So I mentioned that some of the cost drivers sort of have a bigger impact than others, and I think you probably are well aware of this concept, that there's certain things that are going to impact the cost of quality and high quality in a way that other factors are not as likely to. The rent isn't as likely to be linked to an element of quality if it's meeting licensing standards, whereas these sorts of things are directly related to it. So there's obviously the cost of quality varies if we start with just meeting your licensing standards and meeting with the ratio and group size, as your quality standards come into play, if the ratio changes at higher levels of quality, then clearly you're going to see a higher cost per child to deliver lower number of children to a teacher, lower number of children in a classroom is less revenue coming into the classroom. So at higher levels of quality, things like the actual cost as well as the available revenue may shift with how you meet those quality standards. So those are some of the big high quality cost drivers that can vary. We'll also know that then obviously compensation, again, compensation being such a huge component of the overall cost of any childcare program, then depending on what program you're delivering or what model you're delivering within the state. So if you're one of the Oregon pre-K programs and you have standards you have to meet for the compensation of the teaching staff, then your salary and compensation may be higher than a program who is just meeting licensing standards and what they pay their teaching staff. So clearly, depending on what you're modeling and what program you're delivering or what you're modeling in the cost model, you're going to see different compensation levels. And that is going to be one of your biggest costs of high quality that's going to consistently go up, is that compensation often goes up with higher levels of quality, or we attempt to have compensation go up with higher levels of quality. Overall, and this plays out, and we just wanted to share a snapshot. This is not from the Oregon model. This is from one of the online CAP tools around where your childcare dollar goes, but it is a great demonstration of the impact of salary and benefits as the proportion of the cost per child, and how they really do take up. And this is sort of, commonly understood in human services that salary and benefits are between 60 to 75% of any budget. Well, when we think about them as a cost driver and the cost per child for serving children and families with childcare services, we see the same thing bears out. And you see with the first two bars are infants and toddlers, you see that the cost of salary and benefits together is a greater proportion of the cost for an infant and the cost for a toddler than it is of a preschooler. Not a huge difference, but a little bit more. And that's because the staffing requirements are more intense for the younger ages of children. That speaks to that idea of the ratio requirements and the group size requirements, in particular for revenue, but ratio for expense, are different. It's a lot more staff intensive to serve infants and toddlers than it is to serve preschoolers. And so it's a higher cost per child for the proportion that salary and benefits is of that. And so what we're going to next do is then sort of think about your model in practice. How do we translate these things, these cost drivers, thinking about the quality standards and regulations? How do we then translate them into that model that was built over the course of 2020 and into 2021? And so first we started with this piece of the salary options that would be available in the model. These are tied to 3 different levels in essence within the model, and tied to sort of the delivery of this type of service in the community. So again, thinking about like a licensed program, and for that licensed program, we used that robust provider data collection that we were able to secure through the survey process to inform what the salary point would be for a director, teacher assistant, and so on. The different things that were asked in the survey informed what salary was at the license level. Right now, we're looking primarily at the center-based. We're going to look at some of the nuances of your home-based model here in a second. There's a separate slide for that, but I just wanted to note that we're kind of focusing in on some of the implementation of these different approaches in center-based settings. Then we took and looked at the regulations and sort of the practice around implementing baby promise and preschool promise, because that's sort of another place that the salary looks different in how services are delivered. There generally, we see higher salaries from not just data collection, but then also what's required in the regulations for baby promise or preschool promise around expectations of salary. So we wanted to take those regulations into consideration and ensure that the model accounted for that, so that when you run scenarios of a program delivering baby promise and preschool promise, the salaries are commensurate with what is required of the regulations, and also sort of where you're going towards of what you want programs at those higher levels of quality to deliver on. And so we used the preschool promise manual. There was annual salary targets and minimums that were in there. We used those, we transferred those to apply to baby promise as well, since there's not sort of a comparable set of manual, or there wasn't at that point in 21 for baby promise, but we wanted to hold that same idea that there were salary targets, annual salary targets, and transfer those for baby promise teachers assistants in the same measure as they are when preschool promise and teachers and teachers assistants. And then we looked at, well, as for the director salary, really thought about, well, in the data collection, this is typically the difference between the teacher and the director as far as salary. We applied that gap to what were the targets required for baby promise and preschool promise related to the teacher. So we kind of made that consistent across these different salary levels. And then, as Simon talked a little bit about this idea that obviously we're always kind of thinking about that, where are we trying to head with salary, right? That while we want to model and understand our current reality as we are trying to move towards increasing rates and compensation that is good and fair and retains teachers in the classrooms and retains staff in the childcare programs. We also have salaries tied to the aspirational level, which it really is about the targets across the qualification levels from the baby promise guide for the annual targets, and kind of adjusted the floor up from there to have aspirational. And this was all things as both Chris and Simon mentioned, that the work group, technical work group, advised us along the way in making some of the different decision points. And that's always a critical piece of any modeling process, is that we're working with stakeholders in the state to have these discussions and say, we can go this way or that way. What do you think? And here's the kind of pros and cons of a given decision and an assumption that's going into the model. So it looks a little bit different for home-based, as I mentioned. Oh, sorry, before I go to home-based, I didn't realize that that little bit on the slide didn't fly in on its own. But one note about the salary data, it can all be updated with, there's a tab within the model so that the user can input salary. So everything that I sort of walked you through is like the defaults that are coming with licensing, the baby or preschool promise, and the aspirational level. You can put in any salary and model it as well. So the model has a lot of that sort of functionality. That was one of the things that we really heard loud and clear from you as a state of leaders, is the desire to be able to model lots of different elements of scenarios with your tool when the tool was finished, to not have it be that sort of there's only 3 levels of quality and here's the 3 outputs we get, but to be able to do a lot of different functionality. And salary is one of the biggest ones. We're being able to put in user inputted salary is often really important, especially when you get a couple of years out in your model and you're trying to raise salary a little bit more than even maybe what you could think of when you were building the model. That user inputted salary is really helpful in that way. So next, let's take a look at the home-based model overview. So there's 2 elements of the home-based model. And so this is your family childcare settings. And the first is the registered or certified family childcare settings. And then the other is your license exempt settings that are regulated and receive subsidy, is the kind of the population we were really thinking of. And as we mentioned earlier, the data collection involved these stakeholder audiences as well, and working directly with the labor partners on accessing license exempt partners and gathering data from them too. And so we do, as part of building family childcare models, put in a salary for not just the assistant teacher or teacher that an owner may hire, but also the owner or provider themselves. Because otherwise, when we come up with a rate and a cost per child, it is really not allowing for the fact that it is a small business. The family childcare, the individual is a small business owner, and that typically their revenue, it becomes their salary at the end of the year. When we see a rate that doesn't include a salary for the owner, it really is kind of masking how much it actually costs to deliver family childcare. So what we approach, and again, this is one of those really important points of discussion with states and communities around what the best approach is where do we align that salary to? So in this particular model, your owner director salary in the family childcare model is aligned with the lead teacher from the center-based settings. And then assistant teacher is a little bit more clean cut, because it's often we have salary data on assistant teachers that are hired in family childcares, and it often aligns with the assistant teachers that would be hired in a center-based setting as well. There's also quality variables built into the home-based models, including the cost of subs for covering family engagement activities, professional development, time that the owner family childcare provider needs for planning for the children, curriculum implementation, all the same things that you would expect and see in a center-based setting. And then there is when there's more than 2 infants, moves up, an assistant is added. So there's a sort of some cost driver linkage to the number of children or the ages of children served that relates to regulations too in there. This model does add in particular, and this came from conversations with stakeholders, instructional support staff in order to serve children in families with the children have special needs in the family childcare setting. So that was something that was really an important consideration in understanding cost for the Oregon communities too. And then similar approach in looking at the features of how the model works for the license exempt settings, the salary as well. This one using the $14 an hour and the number of hours, that's your typical equivalency. The 2,080 hours a year is a 40-hour work week over the course of 52 weeks. Included benefits can be added in. So this is another kind of feature of how your models allow you more functionality and what makes sense for what you're trying to model or what scenario you're trying to run within the cost model. And then we did build in non-personnel expenses, largely informed by the data collection that was done with license exempt providers around their actual expenses, and just had to base them on kind of how many children typically does a license exempt provider serve. And so this was based on serving 3 children. And these are the different non-personnel that we built in as well to account for that. It's often can be a little bit harder to build a model for license exempt because without being held to sort of regulations and requirements in the same way that centers and family childcare homes are, kind of coming up with, well, then what are we modeling? And so it was really helpful to have that data collection process to understand their expenses help us. One thing that we wanted to share before we go to a little show and tell with the model itself is the salary ranges that were used in the model. So this goes back to some of what I was just talking you through and how it's built into the center-based, and then which positions are used in the family childcare model as well. And you'll see, and this is because of things like step levels and the fact that there are differences of regions, you see that it ends up really being a range for each position. There's not a single salary that's in there. And this is all, again, with the caveat that you also can do user inputted salaries too. So that there are many different salary points that are being pulled from based on things like, if you look at the infant toddler teacher and the middle column, the baby or preschool promise column, that position can range from just over 34,000 to just over 46,000. And that has to do with what step level then that position is at, as well as being a baby promise provider. So, and same thing with licensing. There are 3 or 4 step levels included at the licensing level. So it's not just one salary point at the licensing or one salary at the aspirational. It also links to a little bit more granularity on the different levels of qualification within a given level of quality too. And that applies across all the different positions, the assistant teacher, the preschool teacher, of course. So just sort of reinforces the amount of nuance that is available in running the model and the scenarios that you can run when you're working in it. I'm going to pause, make sure there's not any questions in the Q&A. I haven't seen any yet.
No, and they've been responding to as we go. And I think as we move to the model demonstration that Jean's going to pull up now, I just want to reiterate that this is a model and not a budgeting tool, right? So one of the things that often comes up is the question of, well, but I have a teacher at this level and this level and this level, and we are not building a tool that reflects every single provider's budget. We are building a model that is meant to provide a good estimate, informed by data, informed by all that great data we've just been talking about, to give you, and then we build some model scenarios. And as Gina shows you the model, you'll see how this plays out more to get to that point. Because often we get that question of, well, but we aren't able to pay that amount. And there's 2 things of, one, it's like overall, what does the salary number in the model look like, and how does that compare to your salaries, what you should look at rather than individual ones. And secondly, being like, we reflect that you might not be able to pay that salary at that level yet, but part of the point of this is building this model to move you to the point where you are actually fully funded to pay at those levels, right? And certainly at those licensing ones, you're moving to being, that's where you are. We don't want to only build a model that kind of reflects the current sort of poor salaries. And certainly can't, even for the fact that when we collected this data and we're asking for like 2019, 2020 data, minimum wage might be different to where we are, talking now in 2022. So, there's lots of those things that we have to kind of work through as well. And that's why we kind of build up the salaries to a different point and worked with the work group. And that's where, looking at the baby and the preschool promise numbers, which are based on, the manual and the minimum and the the targeted ranges, helps you move beyond current practice to where practice should be.
So Simon's sort of answering Sue's question that's in the Q&A there with that last couple statements that he made, and I'll just kind of pick it up and like officially answer that question about the salary ranges being based on current ones in Oregon. So yes and no, but yes in the way that you're so I'll go back to that, this range. The licensed column on this chart is from data collection, the data collection that was done over the course of 2020, asking folks to sort of look back before COVID because of some of the realities of the change in implementation that was occurring during the early days in particular of COVID. So we were trying to understand sort of what you paid people, what your operating expenses were before the pandemic started. So that's what informed the salary ranges that were used at the licensed level. It also, we looked at the step levels and sort of the idea that the salaries change a little at higher step levels. So we accounted for that as well within the licensing level. That then applied even more as we then as Simon was just mentioning, using the baby preschool promise manual and looking at the annual salary targets that were in that manual, and then those two sort of are a range, applying that range to multiple step levels that are the targets for baby and preschool promise staff, built the salary ranges for baby and preschool promise. So I would anticipate, and from having some conversations with programs as well as state ELD staff around the implementation of baby and preschool promise, that in some instances, these may be the salaries that programs are using. Some may not be there yet, right? Because the salaries are built using that annual target in the manual as the basis for what the salary range would be. Some programs may be paying some staff at those, but some may not have achieved that yet, and they're working towards it. And then aspirational is obviously truly that. Those are aspirational. And again, they may be in practice at a program or two, but they're not even attempting to say that we are seeing salaries this high consistently across all childcare programs for these different positions, but that this is more about understanding what you're trying to move to as a compensation approach for childcare. Just checking. Okay, so I got it. Not another question. All right, then let's take a quick look at the model. I want to watch my time here because we also have some results from the model that we want to share with you. So we might not spend as much time kind of playing around in the actual tool, but this screenshot here shows you what the first tab or the input tab of how the model functions. And we're going to look at it live here in a quick second so you can just see how some of the things change. But you see that there's pretty explicit instructions and how it functions around things like the things that you need to input, like the number of classrooms that you're modeling. And then there's also things that are related to those quality variables. And so we shaded quality variables in green, and the things that you have to make those selections about. And the way the Oregon State model functions is really pretty cool in that you could, and you can see from this example that the screenshot has up here, is that you can choose the quality level of licensing for an age group, but you can choose a different quality level for a different age group. And that's exactly what this particular example is doing, is acknowledging that there may be a preschool promise program out there that is not functioning as a baby promise program yet and is functioning at licensing level, is more appropriate for where your salaries are. So the model allows you to make that selection. So it's not as if every classroom has to use the same salary range. It allows that sort of distinction, it's a pretty cool functioning, all the different like sort of things that you can turn on and off or select within how the model works. Then you do have to go further down there. Having a lot of functionality and a lot of different things you can model or run scenarios on means a little more in the input world, right? If you were just picking 1, 2, or 3 star level and everything came with that level, there's a lot less that you have to do as a user. Your model requires you to do a little more as a user, but you're getting a lot more nuance out of your output. And so, for example, here you see that then the next thing you have to do is you also have to put in the qualifications of staff, the percentage of staff at a given step level. So this is where we get to those ranges. Even within licensed, there are ranges of salary, and the model needs to be told who falls at what step level or what percentage of staff fall at a given step level in order to draw the right salary in and use the right formula or composition of salary based on the step levels that folks are at. There's also then further quality variables, and I'm going to switch over here really quick and show you the actual Excel workbook for one quick second so you can see further down, because I can't scroll any further down there on the screen share than where we were. So, okay, I will be back. Okay. All right, so hopefully now you can see the Excel file itself. Acknowledge that when I'm sharing an Excel workbook, things might get a little small on your screen, so I apologize for that. I'll try to zoom in here just a little bit, but there's where you get to do things like select benefits, yes or no to health insurance, the number of sick and paid leave days. There's some defaults that we've put in there, but those are also things that can be changed. The other thing that I wanted to share our quality variables around selections around things like family engagement. So there are levels within family engagement, whether you choose that you're going to function at the EHS level for family engagement or the baby promise level for family engagement. There are different costs that come with those different levels. EHS or aspirational in both instances, whether it's infant, toddler, or preschool, being the sort of most expensive and the largest cost driver for family engagement, professional development, and planning and release time. So you've got lots of different functionality. You see over here with the salary override box is where you user inputted salaries. So this would be where for the teaching positions, as well as the director and the assistant teacher, you can put in different salaries than what the default would be for licensing, baby or preschool promise, or the aspirational level. You can override those entirely. And then part of what you're going to find here is that the way the model functions is then results are summarized right here on this input tab, as well as then calculations around the gap between subsidy and the actual cost of care, or the true cost, which is what the model is calculating, and seeing those at the idea of subsidy payment or the public funding compared to tuition or tuition data that's been captured through your market rate survey process. And so again, with the interest of time in mind and the fact that just kind of showing you here in the model where you get some of your results, I want to move us to seeing some results being generated out of the model. So you get a little snapshot of that too this afternoon.
Yeah, thanks, Gina. So, I mean, I think what you can see there is the complexity of the model. And, you know, what Gina didn't show you was the multiple tabs that sit behind it with all the data in. And so, you know, Chris just answered a question in the chat about, you know, talking about, you know, a modified version of the tool will be available so that, you know, it isn't out there in a way that can sort of, it's very easy to break the tool is one of the things we often say, and you know, then you get results that are not actually informed correctly by the data. And so we always try and make it clear that, you know, what can be changed, and what you're seeing there is all the things in yellow were the things that you can go and input and change. But you know, there's all these other things like subsidy rates and tuition rates and non-personnel and everything else in the background that
so those are those revenue
formulas
tabs. You don't want to
and
change
things.
those.
Yeah. So as Gina was saying, you know, this kind of goes back to the question of like what we often get asked in the question. So what is the answer to the question of how much does childcare cost? And you know, kind of, I think like hopefully you're all seeing right now is it's hard to answer that question with one single answer, because it depends what scenarios you pick. And so, but we did run a few results. So you know, I just want to give you kind of an introduction to these results. You know, as we were saying, it allows for, you know, estimating different scenarios, and even to the extent of it isn't just, you know, preschool promise yes or no. It's like, even as Gina was showing, it's like for each of these different variables, you know, do you want it to meet preschool promise standards or not? You know, so you can really kind of mix and match as you're getting there to answer that question of what's the true cost, right? It depends on the inputs and it depends on the you know, the decisions and what levels you're picking there. But having said all that, you know, we ran kind of three sort of simple scenarios just to kind of give some illustration of what you can do in the model. And so we ran one at a sort of base that basically means that it's meeting the minimum licensing standards across the board. One that is, you know, for infants and toddlers, meeting all of the baby promise standards, and for preschool, meeting all of the preschool promise standards. And then a third one that was kind of the aspirational model. And this includes higher salaries, but also, you know, other sort of quality variables that the work group and through the data collection, we kind of heard from people, you know, so that's, you know, extra, you know, paid planning time, having a sort of full-time or part-time support worker for the family engagement activities, etc. Kind of really moving to the like, what should this look like if we were doing this in a way that sort of we're hearing is the highest quality. And then, what we also did some comparisons of this to the current subsidy rates, just to kind of give some, estimate of how you can show some of those gap scenario, right? And showing the gaps between, estimated cost and the majority, the main public funding stream at the moment. For the centers, I'll just note we ran it as a program that serves birth through school age. So it's a 4-classroom program with an infant, toddler, preschool, and a school age classroom, just so that we could build that model that is kind of the sort of the default that serves all ages. But as we said, the numbers would change significantly if you dropped some of those or changed some of those, and you can do that in the model. So this first chart here just shows you kind of some initial results. This is the monthly cost per child in a childcare center. And the first, it's broken down by the age, infant, toddler, preschool, and school age. The first sort of bar, the darker green, is that first scenario meeting licensing standards. Then baby promise for infants, toddlers, preschool promise at the preschooler age, and kind of equivalent sort of standards in the school age. And then that aspirational. And so what you can see here is, we're talking about, even at the minimum licensing standards, about $1,500 per child for an infant, $1,300 for a toddler, $945 for a preschooler, $469 for a school age. And when we say school age here, this is, it's a monthly cost, but it's based on an annual estimate, and then divided by 12. And that annual estimate so accounts for the child being there before and after school during the school year, and then full time in the summer. So it's not, some months it would be more than $469, some months it would be less, but it averages out to $469 a month, and we do that just to be able to compare across. But what you see there is, for meeting the higher standards of baby and preschool promise, it goes up a bit. The aspirational level goes up a lot because of those changes in salary and because of those additional staffing in there. I will note that, these are statewide costs. The tool does just provide statewide costs. One of the things that we found in doing the data collection was there was a little bit of differentiation in salary across the regions, but not as much as we were expecting to see. And so it's not enough to lead us to recommend, running the model at different levels for different parts of the state. And, I think one of the things there was some of the salary, where some of the places where in some of the rural areas salaries were lower, they ended up being lower than the minimum wage or the kind of upcoming minimum wage. So we kind of had to move them up anyway. What we tended to see was there was more of a difference in salaries based on the funding streams that providers had. Programs that had access to, more public funding streams, if you had access to, Head Start money or some, OPK, to kind of support your program overall, your salaries were a bit higher. And of course, the way the market works at the moment, the link between if you're in an area that pays higher subsidy and what that relates to what you can afford to pay teachers, there's a somewhat of a cyclical thing there, which is, probably why we saw some of the salaries even lower than kind of minimum wage would be in the rural areas, because maybe they're not working full time, and that then doesn't meet the sort of quality standards that we're setting up in here. So that's the sort of thing, as you're kind of moving forward with alternative methodology, you're going to want to dig into more to kind of check on some of those assumptions, but just to kind of give you that lay of the land here. And just briefly on the next slide is the family childcare data, the registered and the certified. So the registered is there on the left, the certified is on the right. Similar story in terms of, how the numbers go up across the 3 scenarios. This, we just show an infant, toddler, preschooler number and a school age number, because essentially, in a family childcare provider, it's really one classroom. So you don't have the same ratio group size issue that you have in centers that is driving a different cost by age. We saw a mix in our data collection of providers who charge different rates based on age versus others that just charge one rate. For the purposes of the modeling, while we know, under for infants, there's a sort of cap on how many infants you can have. The model assumes you basically have no more than 2 infants in the registered home at least. And then, but essentially, you know, it's kind of, it's one classroom. So that's where the numbers come out here. And you know, these include those salary levels that Gina was showing. So I know we're tight on time, so I just want to show quickly this one quick, we'll just show this one gap analysis chart. So we ran the numbers for a center at the meeting licensing standards. And this is then the monthly gap between what that estimated cost is, so that, you know, $1,500 for an infant that we showed you 2 slides ago, and what the subsidy rates were paying as of the subsidy rates that were in place during 2020, which is when this data was collected. And what you see is on the urban side, you know, you're losing money on infants, about $89 a month. For toddlers, preschoolers, and school age, you know, it's covering about the cost of the minimum licensing standards. In the suburban and rural rate regions, you're losing a lot of money, you know, especially down on infants and toddlers, but even on the preschoolers and school age, you know, which is reflective of how, you know, you have very different rates in your urban versus your suburban rural areas. But what we found on the cost side is there's not really that significant of a difference in cost, especially if you talk about, you know, paying teachers, you know, at a salary scale rather than at sort of a market rate, you know, of what you can get away with paying them, but paying them where you should be. And so you start to see here what you can start to do with this data, right? That, you know, if you just set rates based on the market rate survey, you end up reflecting the deficiencies in that market where you can get away with paying people in rural areas less money because there's not as much competition for jobs. When you move to paying on cost, on actual cost estimation, you're saying, what does it cost to do this job? What does it cost to run this program? Do we want to pay a teacher $40,000 a year? If we do, the cost is this, and then the rate should be this. You know, so you start to move to actually setting rates that are informed by the cost rather than driven by the realities of the market. And so just to kind of wrap us up on this next slide here, you know, we didn't show a ton of different charts there on the results because of the fact that the results are so specific to what scenario you're running, right? The point is the model can help you do a lot of these things. So, you know, what we say is you use the model to inform rate setting by saying, let's develop the scenarios that reflect what we want to show, right? So be that licensing standards, be that these different quality standards. And then you can also develop these scenarios that capture those different characteristics. You can run a scenario looking at just a program that serves birth through 5 without school age. You can look at one that just serves preschoolers and school ages. You can run all these different scenarios and see how the cost differs by those. But then you've got to use that to inform rate setting. You don't necessarily set the rate at that number, right? You can say, okay, we want to use this in the same way you take the market price survey and use it to inform rate setting. You take the cost estimation model and use it to say, okay, now we understand the costs, but we can use this, our rate setting process, to make some policy choices, which could include incentivizing certain types of care, right? So you maybe want to pay a little bit more for higher quality to incentivize the extra effort you do for higher quality that's maybe not captured in the cost model. You know, non-traditional hours, right? You want to actually incentivize them by paying a little bit more. Same for infants and toddlers, right? In a family childcare home, you might say it costs the same essentially for a toddler as a preschooler, but we need family childcare providers to serve toddlers. So we're actually going to, you know, cover more of the cost there than we would at the preschooler. You have the ability to do that and for it to be driven by the data. So as you kind of embark on this next step of the work, I'm really moving to sort of thinking about the rate setting piece. What, you know, I hope you're seeing from this is you have a model now. You have a model that is informed by data that you can start to do some playing around with to sort of do that informing of the rate setting. So with that, our contact details will be in the slide deck when it comes out, but I'll pass it back to Chris now to kind of wrap us up as we move into that thinking about your alternative rate methodology committee.
Thank you so much for joining the webinar today. This is exciting work, and we encourage your input and participation as we move forward. We'd love you to consider to be part of our Alternative Rate Methodology Advisory Committee. Our application is out live right now. You can find it on the ELD website, and we will follow up with the link. The deadline to apply for the Alternative Rate Methodology Advisory Committee is January 21st of 2022, and we're hoping to have our first meeting at the beginning of February. As a reminder, the recording of this webinar will be available on our website, and it will be accompanied by the PDF version of the slides, and it will be sent out to registrants, as well as a modified version of the model and some instructions on how that can be used. Please feel free to reach out with any questions and comments to me, Chris O'Grady, at crystal.o'grady@ode.oregon.gov. Thanks again, and have a wonderful afternoon.
Thanks, everyone.